don't hesitate to contact me at all.
Well, and Denise, I can follow some of the questions in the chat box. And if we have time at the end, I'll give them to you. And we will have your slides up on our convention website after the convention.
Okay, great. Now let's see, I'm screen sharing. It's not letting me move the screen. Oh, there it goes, okay. So I am the CEO of COPA. I've been here 15 years, and prior to that, Kim gave you a good idea of my varied background, but I did work for TASH for a number of years as the education director, working for the full inclusion of students with disabilities. And prior to that, I really got my start in all of this as a young professional who was a positive behavior support specialist and working hard to keep students who had challenging behaviors in school, in their home school, and when possible in the general education environment. Since that time, I've become a parent. My son had an IEP for a short time for speech services, and I am now a grandma. And my 7-year-old grandson, Leon, has Down syndrome. So the circle of life continues, and on we go with our advocacy. I'm hoping to provide you with information that will be helpful during these trying times. It is simply information. It is not to be construed as legal advice, and although I will take lots of questions, I'm not really going to be able to answer individual questions about individual students because I don't know all the facts in the case, and things you know, can differ by jurisdiction as well as state, although I know you're all from Virginia, and I hope that you made it through today's storm safe and sound. I'm up here in Baltimore, and I know we did. Hope that, I guess if you're on here, you did, but hopefully you didn't have much damage. I'm really proud to represent COPA. I don't know how many of you know about COPA, and hopefully some of you are members, but we are a national organization. We're a nonprofit. We're small but mighty, I always say. We have 5 full-time staff, and we have thousands of members across the country that do the work of COPA and volunteer every day to help us put together information sheets and analyze situations. And right from March 12th, from the moment schools closed, our members have been very busy putting out information and helping people to understand how the laws apply and how their rights apply in these times of COVID-19. COPA is, as I said, we have thousands of members nationwide. We have attorneys, we have advocates, we have family members, we have related professionals, we have students, and we have a directory of folks on our website, www.copa.org. So if you're looking for specific representation or someone to help you with individual child's needs, please do consult that directory. So over 90% of our members are family members, and so it's a very personal issue for most of our members, and they go approach everything with passion. One of the things, you know, COVID-19 has really upended our lives. There's no two ways about it. It's a scary and unprecedented time. It has upended the lives of educators, and it has upended the lives of families, and perhaps most importantly of students who, although many of them have been troopers and really adjusted in the beginning, may not have and may still not quite understand what is happening in their world. So I think that the pressures of all of the things in life that go on with COVID for us and for educators sometimes can make things more stressful or make us less able to see clarity around issues. So one of my hopes for today is to really ground us back in the core principles of federal law. And one of those is equity, the right to equity for each student with a disability, and every student in this country, is to, you know, hopefully that people get equity in their opportunity and in their ability to benefit from our nation's laws. One of the things that the COVID pandemic has brought to light even more than we already knew, of course, are the inequities. And so some of the things we're talking about today, some of the solutions people have found may work for some of the population, but may not be equitable for all of the population. So we do need to keep equity in mind, but we also need to keep some of the other provisions and goals of federal law at the forefront. It's very important to understand that the goals and provisions of federal law are the same. There have been no changes, no waivers, no repeals to federal law. Now, I don't know whether or not Virginia has put on hold or waived or made any changes to state law. That's something you want to check out. But as far as the federal laws go, the IDEA 504, to date, and thanks to the advocacy of lots of folks like you from around the country, the school association's attempts at rolling back those rights or waiving any obligation under the law during the pandemic have failed. So all of the statutes and the goals and the provisions of those statutes remain in effect. One of the things that we hear from, are what we call a lot of excuses and or attempts to skirt responsibility under the law. Well, we can't provide services to any students if we can't provide them equitably to all students, because we know all students don't have access to distance education. Wrong. Do what you can, provide the services to all students, then triage and work to make them equitable, work to bring additional services, additional access, additional resources. So we want to make sure that people in the districts are not using the pandemic to skirt their responsibility under the law. Excuse me. We have also been from the very beginning, again, so reminding people of the core tenets of the law, but also reminding people of the need for collaboration, the need for communication. Both of those things tie into parents being meaningful partners in their child's education, and also the need for individualization. Making blanket decisions such as no child with a disability will receive any services whatsoever during the shutdown could be a violation or run afoul of the law, because the requirement to provide FAPE to students remains, regardless of whether schools are closed or regardless of whether the learning is taking place via distance learning, in school, or a combination of both. So I'm going to revisit those core things a couple of times throughout the presentation, because I think every time that a situation comes up, we have to remind ourselves of the issues around equity, collaboration, communication, and individualization, and ask whether or not those things are occurring. We also need to be very aware of whether or not the student continues to receive a free, appropriate public education or FAPE. That includes challenging and ambitious goals that's commensurate with their abilities and in light of their circumstances. Those of you who are legal or policy wonks might know that language comes from the Andrew F. case, which is the most recent interpretation of IDEA, or the obligation to provide FAPE under IDEA, I should say more specifically. And, so again, some of the districts tried to say, well, in light of the current circumstances, we can't provide any education. Well, the law is not talking about the district's circumstances or the circumstances of the, general community at large. They're talking about that individual child, what they need, and what should be provided to them. So let's not let the pandemic change the meaning of the words or the interpretation of the law. And we'll keep revisiting this issue of FAPE throughout the session. I'm going to go back again to that, those notions of collaboration and communication. The partnership is just incredibly essential. Some of you I know because we've heard lots of stories, and I want to give a shout out to all of the families and educators, states and districts who really embraced the need for continuity, for continuing learning for students, the need to do as much as they can to meet parents and students where they're at and really take the time. One of the things, you know, given that COPA has a lot of attorneys and advocates and family members, and that we particularly focus in on parent and student rights when the law is not being upheld or when there is some dispute over implementation, we typically hear a lot about how things are not going right. So one of the things that was very different in this environment is that we heard a lot of stories of schools really working with parents and teachers, sometimes for the first time, really able to talk freely and meaningfully about the child and how they access information and what ways they are able to learn. I saw this with my own grandchild. He does have a communication device. He's nonverbal for the most part, although over the summer, or since March, he's been, he lives with his mother in North Carolina, but he's been with my daughter and her boyfriend, who is his dad, since March. And his IEP is full of information around using the iPad to communicate. And what they were actually able to observe, and he's in a self-contained classroom with a lot of other nonverbal kids. And what they were able to observe over this time period is when he's around his siblings who are very verbal, his speech has increased incredibly since that time. He has absolutely no interest in using the iPad to speak because nobody else speaks that way that he knows, and he likes to imitate folks. And even though he's the best one in the family at operating his iPad, it's only when it's something he would like to watch or when he has control over swiping, pushing, and those things. But try to sit him down in front of the iPad for a particular lesson at a specific time with a specific teacher, forget it. He acts like he's never seen the iPad before in his life. So working through some of those issues together has really been, at first was really a challenge, but then became rewarding. Unfortunately, there were also many families who did receive notice that no services would be provided or who did not receive any kind of communication whatsoever. So one of the things that we have seen throughout the as I said earlier, throughout the pandemic, it brought to light many of the inequities that are in the system. It also brought to light what we know are the inconsistencies in implementation of the law and how it varies by district, by school building, and sometimes by the people that are in the building and the specific educators or service providers. So all of that has played out during the pandemic. But one of the things that, again, has not changed is that parents need to have a very strong voice and significant voice in the process of determining educational decisions for their child during and after the pandemic. I know many of you are in the struggle of trying to decide and trying to understand what your schools are doing. Some of you have already begun school, perhaps, or will be soon. and trying to decide between the different things that are being offered. And one thing I just want again to emphasize is that you need to have part in that decision making based on information. You are to be meaningful partners in your child's education. And if the district's asking you to make decisions, such as some of the surveys that went around about whether you'd be participating in person or in virtual or a combination of the two, but you don't have any information about how that will actually operate, what specifically your child will be doing, how they will keep your child safe, then I would argue that you cannot be a meaningful participant in making that decision. So keep in mind that you do have the right to that kind of information and to make decisions for yourself and your family and your child. Again, we've seen folks across the country that really did experience partnerships, schools that went out of the way to do things like bringing communication devices to students' homes so they could work on their IEP goals. Or, as I said, sometimes family members were able to find out much more about their child when they saw them. Like one mother told me that her daughter always came home with these really great pictures, but she thought that the teachers were telling her what to draw. She knew she was a good drawer, but she thought they were telling her what to draw. And she realized throughout the process of her seeing her do it at home that she was able to think about what she wanted to draw, relate it to the subject, and then organize herself and draw the picture. And she never knew that before. And so some of you may have experienced that same kind of silver lining, as it were, for us. As I said, with Leon, the silver lining was the amount of verbal, how much his talking has increased just by being around everyone. And the other day, my daughter said to her boyfriend, said something about, did you enjoy going out? And she said, yeah, I needed it to put me in a better mood. And then Leon came over and wanted to sit on his dad's lap, and his dad said, not right now, buddy. And Leon goes, yes, better mood, dude. So he was, that's quite a gain to be able to go from hardly saying a word. But on the other hand, his behavior has been very challenging and very stressful for the entire family, and they're home together all day, 24 hours a day. So I know I'm not telling you anything you haven't experienced there, but again, it varies widely by students. There are students who have made gains using distance learning. There are some students who actually enjoyed not having the stresses of the school environment, the external demands or noises or peer pressure, and have really excelled in the online environment. And then again, there are other students who have limited or no access and have really fallen behind. So as we go to looking to schools reopening, what do we know? There, unfortunately, are many more things, more questions than we have answers to what we know about how it's all going to work. Are kids going to actually keep those masks in place? How long will they have to keep them there for? What will they do with them when they're not on their face? That's a horrifying thought for many of us. And how are they going to keep the environment safe and clean? How often will they be there? Who will they be with? Will there be some sort of hybrid learning for some students? And again, make sure that before you make those decisions, and parents are going to have to make those decisions for all children, but particularly for students with disabilities, remember that the IEP team should be part of that discussion, and you as a meaningful partner in that process need to also be part of the decision making. Most importantly, in the, you may know and you may remember from in the IDEA, the requirement is that you first decide the present levels of performance of the student through evaluations and data. Then you determine the needs that go into the goals, and you decide the services and supports that the student will need. And once you've done all of that and the team agrees, only then is the placement decided. So don't be misled or tricked into thinking or believing or agreeing with this school if they're trying to get you to decide first whether you're going to do hybrid or in-person instruction or online only, and then develop any level of service based on that decision. That's not how it works. The student needs are the needs. The services are supposed to be decided ahead of the placement, not based on the options that the school is presenting. So I'm going to again bring you, whoops, how do we get on that one? I think I went to the end. Sorry about that. I'm going to bring you back again to these same slides to say the goals and the provisions or requirements of the IDEA or 504 are the same. We need to make sure that there's collaboration, communication, individualization. If the schools are saying things to you like, only the students with disabilities will come back to school 5 days a week. All of them will come back together and they will learn together in a segregated environment. Well, if that's not what your child was doing, you know, remembering the requirements of the law for LRE, the requirements of the law for individualization and for decisions to be made based on services to be provided, and the need for the school to first attempt to provide those in the least restrictive environment, which is always the general education classroom alongside of peers with disabilities. One of the things that schools have over time convinced many to believe is that there is a least restrictive environment for each child. That is a myth. We have a blog about it on COPA's website. That under the law, it's very clear if you read the letter of the law that the least restrictive environment, which is a term defined specifically, and not all terms are, but that one is, and it talks specifically about the general education classroom, access to peers without disabilities, and access to the general education curriculum. If there's a decision to remove the child from that environment, then that becomes a FAPE discussion. What is required to have them have a free, appropriate public education? But it, again, should be based for that child, not on a program that the school is delivering. So, you know, if you're questioning decisions like that by the school, you are right to do that. And you should be, you know, within your bounds to push back based on your child's needs if you need to. The right to FAPE, we believe this also, you know, applies when students' parents opt to keep them out of the physical building, even if that option is provided for the 2021 school year. We have asked the Department of Education to put this out in guidance because one of the things that we're worried about is that districts and families are going to start to use terms to describe the situation that's going on in a way that will deny them of their rights. So for example, well, I'm going to talk about it in a minute, but a couple of examples of that are using the terms homebound or homeschooling to refer to the education that's taking place in the home. And for this particular scenario, we want to, unless you really mean those terms, and I'm going to again define them and talk about them in a second, we want to be careful of using those because they do end up having an impact on services and supports and or rights. So I'm not advocating, or COPA is not advocating for any particular placement or decision for any student, because again, that's an individual decision. But the concept of FAPE is embodied in the IEP. And so again, that is a term that isn't defined in the IDEA, except for that the schools have the obligation to follow the procedures in the law and to provide the student with meaningful benefit. And the team's goal is supposed to develop that individualized program to address that student's unique educational, social, emotional, and behavioral needs. And it specifies the education and related services that that child needs. So if you're going to do something different, let's say the entire school's going back full time for all students, and you decide to keep your child home, but you want the IEP to remain in place and you want the program, you want to talk to the team about what aspects of the program they can implement through that kind of model. And you want to make sure that you document that as a time limited situation just for the agreement during the COVID-19, and that as soon as it's whatever your criteria is, either you have called the team to discuss a change in placement, or there's a vaccine, or the incidence of COVID have gone way down, or whatever it is, or a specific date where you're going to revisit it. You make sure that you put that in there as an attachment to the IEP so that you retain your rights under the IDEA. We've seen too many instances of parents or students being criminalized for virtual learning choices, saying that the student who didn't show up for all of the classes was truant, or we actually had an example of a student in Michigan that was arrested for failing to turn in an assignment because they were on probation for other things. Sadly, we know from our experiences over the years that the extreme examples we hear about that make it to the media or make it to our office are really representative of a lot of other things going on, happening to other parents. That's problematic, that we may not hear about. So that's one of the other reasons we're asking for the guidance, is to make sure that this kind of thing cannot legally happen. Again, I talked earlier a little bit about homebound versus homeschool. Homebound is a placement on the continuum under IDEA that has very specific guidelines and generally requires the child, only the child, to have issues that present medically, that makes it unsafe for them to return to school. It generally needs to have a doctor's note and often reduces services and the obligation for FAPE greatly. Students may go down to just 1 or 2 hours of instruction. So, and also, one of the things that makes this different under COVID is that it may be the mother or the sibling that has a compromised immune system or complicated medical issues, or it might be the grandmother, but homebound would not cover that because it's not the student themselves. The other one I've heard, my grandson's mother said this to us, called up me and my daughter, who she talks to a lot about some of this, and said, I'm just going to homeschool Leon. And I said, well, wait a minute. What do you mean you're going to homeschool Leon? Like, you're going to actually pull him out of school and open up a homeschool? And do you know the North Carolina regulations for homeschools and what you need to do? And she goes, oh, no, none of that. I'm just going to teach him here and not send him back to school. And I said, well, then you're doing distance learning. You're not doing homeschooling. And again, very important terminology to understand, because if you go into the team meeting and say, I'm going to homeschool him, then they think you're taking him, the child or them, out of special education services, revoking consent, and or limiting the amount of services and the child and parent rights under the IDEA. Typically, again, you'd want to look all of this up under Virginia state law, but typically students are limited to equitable services. However, the state has defined that, and whatever the formula is, if they are homeschooled. So the district still has obligations for things like child find, but again, the other obligations are limited, and rights are limited in terms of what you can come back to the school and claim in the way of violations to the IDEA or deprivation of FAPE. So be aware of your term. There's been a trend towards, I think people are calling them pods, where the student is learning virtually, but small groups of students and families are going to get together to implement the curriculum, learn together, or do some extra added activities. Again, that's virtual learning. That would, unless of course the intention is to actually homeschool, set up the school and do something entirely different than the typical education program or that the student has been receiving or outside of the IEP. If that's the intention, great, and people know what they're doing. But if you're just simply adding to the curriculum or forming a different way to implement it, maybe because of childcare or just to supplement, be careful of the terminology that you're using. Okay. I'm going to assume at this point, Kim, that you haven't had any questions you wanted me to address, and that I should keep going to the end and we'll do them all at the end.
I do have questions.
Oh, okay. Do you want to throw some out there before I finish?
Sure, hold on one second. Okay, so the first question is, there are a lot of assumptions made about students with significant disabilities at school board level. An example would be special ed kids come back first. What are some of the best talking points to challenge these assumptions and discriminatory generalizations?
Well, again, focusing on the requirements of the IDEA for, the student being educated in the least, with their peers, according to their own individualized IEP. Just making those blanket decisions is not individualized. Now, again, there may be some families who are perfectly fine with that and they like the idea. That's fine. But there should be, again, and then I guess the third one I would say is the meaningful parent participation. So if you were not consulted or provided the opportunity first to review the IEP, remember I said before, we want to go through the present levels of performance, the goals and objectives, these related services and specialized instruction, and the levels for those for each child, and then decide the placement. So if they're just coming to you with a canned placement, not giving you that opportunity, then you may very well have a claim of deprivation of FAPE based on violations of the law, should you need to or choose to go that route. But I would first, we always, especially in this situation, given the unknown, we don't know how the courts are going to look at the situation related to COVID, and we don't know how long it's going to take. And we don't want, people languishing for years on this. So to the extent that you can talk it out and work it through with the IEP teams or through systemic advocacy with the districts and helping them to understand, and possibly with the assistance of, if you need to, of COPA or the National State Directors of Special Ed, put out a document that's on our COPA resource COVID page about the LRE that might be useful, and really trying to get the district to understand how that is could potentially be a violation of rights.
Okay, and the next question we have, if a student complies and not have involuntary behavior while on probation, what is the option for those who do follow protocol while adults still may see them as a threat in the building, or even their parents too?
Not sure I totally understand that question. I'm sorry, could you?
Let me, I didn't read it very well either. If a student complies and not have involuntary behavior while on probation, what is the option for those who do follow protocol while adults still may see them as a threat in the building, or even their parents too? And Janelle, I don't know if you want to clarify anything. Do you want me to just ask them to clarify the question?
Well, I think I get it now. I think it might be that, instead of looking at what we're advocating for is for each individual team to meet and determine what's best for that student, given their present levels of performance and their needs moving forward, and that they not have their, that they look at the current situation, the current needs, the current levels of performance, in making those determinations, and not be either generalizing because of the student's past behavior, and or retaliating, sounds like to me, if they're keeping the, again, I don't know the specifics of the case, but the parent has to be a meaningful partner in the program. So the team meeting, whether it's virtually, which IDEA explicitly or expressly provides for, says you can do, or in person, those same rules of being meaningful, having the parent there, and able to make an informed decision, and provide meaningful participation, still apply.
Okay, and on that same line of questioning, what is an intervention tip or process for those who are in these settings while on probation to prevent these conditions or acts? But once they comply and, I'm gonna start over. What is an intervention tip or process for those who are in these settings while on probation to prevent these conditions or acts?
It's hard to answer that kind of question, I think, generally, because it sounds like there's probably a lot of facts relating to the individual students. But in general, again, I think that the students eligible for IDEA or 504, then a team meeting should be called to review the plans, and you as the parent can initiate that meeting, and you can, or as someone on the team can initiate that meeting and put in writing what your concerns are, or if you have requests relating to times that you can meet, without knowing any details about the student or the probation or what the terms of it are or anything like that. It's hard to say if they are related, but simply violating any aspect of the IDEA simply because that person is on probation, I would argue, might run afoul of the law. So there's nothing in the law that says they don't have to do the things that they were supposed to do when the student's on probation. So they can't make up stuff. Just like that scenario where I said they arrested the student because she didn't turn in her assignment. You can't make up stuff if it's not in the probation agreement, or if they're denying rights that the student is entitled to under the law.
Okay. And then the next question is, can you provide a list of potential accommodations to support inclusive virtual learning, so families and even districts are not starting from scratch in individual IEP meetings? Or is there something out there already?
Well, on the last slide, I did put the Educating All Learners site, and that is the most comprehensive resource that I know for. I don't know whether they have that specific question, resource, because again, we've been really trying to get districts and families to move away from these canned checklists of, everybody gets a calculator or extra time or whatever, and think more creatively about that student and what enables them to learn. And I've heard, some of the accommodations have been, changing the time of day, the seat that the student sits in, so that it's not always the same. School and parent working out some manipulatives or things that go along with the lesson online, having individualized follow-up or small group. The sky is sort of the limit when it comes to some of that, and it should really be based on what helps that student learn. So unfortunately, I do not have such a resource.
Okay. What should parents be expecting from schools regarding IEP revision timelines? It doesn't seem like there's much movement happening at the individual IEP team level. Local school boards mention very few IEPs and 504 plans. I'm sorry. Local school boards mentioned few IEPs and 504 plans would be revised due to virtual.
Well, again, the same timelines apply in federal law or the state law. And if you go back to school, or if the student goes back to school with no changes to the plan, then the previous IEP or 504 plan is what is in effect until the team has met to agree upon services or changes to that IEP or plan, or an amendment has been drawn up and agreed to and attached to, which can happen without a formal meeting if it's a fairly straightforward issue. But it's the same. There is no pass because of COVID on the requirements of the law. So if they should be having IEP to review, before the start of or at the start of the new school year, or whenever they typically would have. And again, even not being able to do it in person is not an excuse. As I said before, the IDEA, unless the parent's uncomfortable with it. If the school was to have a triennial evaluation done that year, they're still required to have that unless the parent and the school agree to delay that. So the parent and the team can agree, for that individual to delay any aspect of the process based on what everybody believes is necessary. But again, if there have not been any meetings or changes to the students' program, then the last agreed upon program is what's in effect when the new school year starts.
I have another question. If you have a student that cannot do virtual learning due to a disability, but the school division decides to do virtual learning, and I think you have addressed this, and they do need to, what do you do?
Right, so this again varies widely. Some districts have been better than others at working with families to figure that out, either by allowing the student to come in for one-on-one or allowing instructors or related service professionals to go to the student's home. There is such a thing as partial unilateral placement, which basically means that if you've asked the school, and you should, all this should, if you can, do through the IEP process, get the team to agree that that's best for that child. And then the question is how to provide those services or in what setting. And again, that's the correct order. So we know the student, based on their present level and their unique needs, is going to work on these goals, needs these services, but now how are we going to get them to them? So if the school's unable or unwilling to provide those, if you have the means to find a resource yourself and ask the school for reimbursement or to pay for those services, that's called a partial unilateral placement, and again should be done through the IEP, or if not, you might need to give a 10-day notice to the school. And if you're going to get into all that, I do recommend that you have representation of either having an advocate or an attorney assisting you with you to make sure that you do all the things that you need to do. But and then if they refuse that, then you have to make the decision about whether or not to file for due process at some point down the lane. We also have been asked, or recommending to parents that to the best extent possible, you keep data on your child's progress or struggles, and that can include, it should include multiple measures of data, so some check marks or however they keep the data typically throughout the year to note progress, but can also include pictures or short videos demonstrating either a skill that's been learned or a challenge that's justification for such as trying, having the child, the student attempt to do some of the online learning, and so that they can see what happens. In some instances, there's been a surprise. The student actually was able to benefit some, and other times, they melted down and did exactly what the family thought they were going to do, but then at least they had documentation, some data to add to the table to make that request.
And the last question is, how can we advocate, oh my gosh, they're all flying in now. How can we advocate at system level for schools to provide IEP supports and services in virtual settings so students with DD are not put at increased risk versus the general population? And how would this relate to ADA rights?
Well, right now, the rights under the ADA are still the rights under the ADA. There is a proposal before Congress, the HEALS Act, that you may have read about in the paper or may know something about, and that specifically has some information in there or some provisions to change some of the requirements under the ADA, such as the provision of accommodations at work. There is no specific information as it relates to education right now, but we are watching it carefully and urging all senators to keep all provisions of the federal law in place. And systemically, again, we have been working, we were urging people to work with, urge Congress to provide additional funds to districts, which are in the CARES Act that was passed a couple months ago, and some level is also in the HEALS Act. However, they don't specifically require that any percentage of those funds go to special education. So that is a perfect opportunity for advocacy at the systemic level, at the state level, at the district level, for identifying funds, for recognizing that one of the things we didn't get to, this is a good segue to keep moving, which is putting a systemic process in place, recognizing that for students who were not able to receive educational benefit or services, a level of comp ed. So I'm going to talk about that in a second. But right now, again, that issue of equity in resource allocation, underfunding of the IDEA has never been more apparent in terms of districts. It's one of the things that we're on the same side of with districts, which doesn't always happen, but recognizing that they need additional resources to do what they should be doing, and assuring that any additional resources they do receive from the government, that a percentage of that is set aside to recognize the needs and the additional requirements of students with disabilities. So again, just to kind of wrap up, and then we'll take a couple more questions at the end, but looking forward, you want to focus, of course, on safety and ask as many questions as you need to do to make a decision. And you should also, there is no reason that we know of that yet that you shouldn't be able to change your mind at any point. So let's say you decide day one, you're not sending your child back. They're going to do virtual only, but then 3 weeks in, you've seen enough, you've learned more, and you feel comfortable sending your child on a limited basis or up to full-time or whatever it is. Call that IEP team meeting, or just send a letter requesting the change. If they agree, attach it to the IEP and as an addendum, and you should be able to make that change. We do anticipate a pushback from the districts if you want to change the other direction. So you were virtual and now you want to come back to school. To some degree, that's understandable because of the amount of planning and things that need to take place, the changes that it would make to the environment. But our guess is, again, there's going to be some students moving in both directions, but also those kinds of decisions, not your problem, not what the law has intended. If you if you decide and the team agrees that the better placement is in person, it's their job to figure out how to make that happen. So, but make sure that continued collaboration and communication goes on. That partnership is going to have to, just keep happening, because it's going to be a while, we think, before things are back to quote unquote normal. Individualize, make sure you keep data and recognize the need for and determine specialized instructions and related services, and have the data to back that up. We want to make sure that that one of the other ways that you can advocate on a systemic level is to help districts learn from each other, because there are districts out there doing some of these hybrid models where they're providing behavior support in the home, or virtual social skills class, or a hybrid, some 2 days in the classroom with half the students and then some at home, or whatever. There's a lot of these different things going on. They can learn from each other, and we're urging Ed to take a role in putting some of that information out for districts to be able to learn from. Last but not least, what I said before was, that a big question right now is, can I get compensatory services for my child for the fact that they either didn't receive anything, or haven't made any progress, or have actually regressed. And our position is, yes, the districts, again, should take some of that money that they're getting from the federal government, put it into a pool and say, we know we're going to have to provide X amount of extra speech and language, or OT, or whatever the services and supports are, and be prepared to do that. But again, those decisions need to be made on an individualized basis. It would be a foul of law to say, well, everybody gets 2 hours of comp ed. No, that's not how it works. They need to look at the present, evaluate the student, look at the present levels of performance, decide what the needs are, and what level of services will put that child in the same place they would have been had the school not be closed. So I'm going to say that again. They're intended to look at where would this child, where should they have been, or where could they have been had the school not been closed and the services provided. So that means that they don't only have to regress. They don't only have to show that they've gone backwards, but just simply not having made any progress whatsoever on goals should also spur the discussion around comp ed. Again, remember, communicate, collaborate, individualize, and keep equity at the forefront. I think we have 4 minutes for any other questions.
Thank you very much, Denise. I do have a couple more. So one question that I have, or comment that I have from a parent, first of all, she wants to thank you. She said it's great information. She was told to get a tutor for her oldest son, and the school was not going to help with that during COVID. I also asked for a teacher to be in contact with him daily to ensure his understanding of the work that is being asked of him. His special ed case manager told me that she will let me know what is available. Is there something I'm missing?
Yes, well, I mean, I'm assuming that that students who, you know, I don't know who did the telling, but if the district or the team has recommended a tutor, then the district is responsible to pay for that. If they've agreed that that's a level of service that student needs, then, you know, they should be paying for that service. And if they haven't done that, then they should be, you know, providing reimbursement from the beginning. Again, that can get a little tricky. So if you don't already have an advocate or attorney, I would recommend that you consult with somebody about the specific facts of that case. But generally speaking, if the team or someone has recommended those services and supports, then and they relate to the specific goals on the IEP, then the district should be paying for it.
And then our last question is clarification. So if you have an IEP plan in place, is it expected that these supports and services will be provided remotely and or in remote settings, even if it doesn't explicitly say virtual?
That's where that communication comes in and the partnership, because I don't think we can have any really expectations. We need to ask the questions and make, you know, and agree on what do these things mean? How will they? What is needed? Again, where's the student? Where's their present level of performance? What are the goals, services, and supports for that student? And then what is the team agreeing on how they will be provided? And that could be different for every student. And really, again, it's this situation, if it's done nothing else, is has been pushing schools to respect the I in IEP and look at each situation individualized. Well, what's going to work for that student? What works for one student in terms of having someone at home to implement the program, you know, having access to online, having the attention span, you know, there's so many factors that go into it. So the same process applies and your same rights are there. They can't just say, you know, that everything will be provided virtually. If you agree with that, great. If not, then you need to articulate your requests. I would like to, you know, have him have his speech therapy twice a week, either at home or one-on-one in the school building or at an outside provider's office, whatever, you know. Again, it has to be in conjunction with the applicable health and safety laws that are going on in I know in Maryland, it's county by county, and Baltimore City, you know, makes up its own. So I don't know how that translates in Virginia, but you know, you can ask for the way you'd like to see it, but just with any other kind of IEP discussion, it's a back and forth to see what you can agree to and whether or not, you know, you're going to have to go to due process if they continue to push back.
Okay, I promise this is the last question. It's from a parent. You mentioned comp ed on where they should be and or could be had school provided services on goals they had.
Mm-hmm.
Would that be on the goals that were in place at the time the school closed? We've since had transition to kindergarten IEP made, so we had updated new goals.
Yes, so comp ed would have to be, at least right now, there hasn't really been enough time to, if it's a brand new goal, you know, if you tried to go to court, they would say, well, you haven't even had a chance to implement it yet. So yes, we're right now, we're talking about the time period from March until now. If during that time period there was something lost, that the school could provide extra to compensate for. That's what comp ed really means. But you know, you can still, if half the school year goes by and they failed to do something on the IEP or provide the services in the way that was agreed upon, then they have failed their obligation, and you may be entitled to some comp ed to make up for that. But right now we are talking about that time period during the closure.
I really want to thank you, Denise. And the parents said perfect, just wanted to confirm, since the school tried to say new goals are in place, so past goals don't matter. Thank you very much. We all want to thank you for being here and presenting. And like I said, these slides will be on our convention website. And thank you so much for taking your time and sharing so much valuable information.
Oh, I appreciate being invited. And again, my email's on the front there, and send me a question if you have it, or if I don't know the answer, I'll try to connect with you, somebody in your state or somebody who does. So thank you all for all that you do, and my best to everybody. Stay safe and be well.
You too. Thank you very much.
Thank you.
Bye.